Hey guys, it's Jen. I hope you guys are doing well. I wanted to do a vlog about my first day at clinical at the psychiatric hospital. So let's first talk about how tired I was Tuesday morning. So it was a 12-hour shift, and it was a lot slower than my previous, rotation. So just so you can get an idea about what a clinical day consists of. So you wake up early and then I was there at like 6:15 and our shift was from 6:30 to 6:30 p.m. The teacher will have a pre-conference and post-conference with you, so you guys will probably meet in a room and discuss what your to-dos are for the day. Sometimes they'll elaborate on the paperwork that you need to do, if you need to create a nursing care plan, answer any questions that you may have when you actually get to the patient and you're interacting. And this is kind of just to make sure everyone's there, answer any questions before you're kind of let loose on the floor, and then that's that. So we had a pre-conference from 6:30 a.m. to 7 a.m. and then we all were assigned a specific unit to go to, and then she dropped each pair off. And then there is a post-conference that's from 5:30 to 6:30 p.m. and that's when you gather around and you kind of discuss things that you've experienced, or if you have any questions about what you saw. And it just helps to kind of fill in everyone else who was in a different unit, just to provide more learning opportunities, etc. So like I mentioned, for the most part for nursing, there's a lot of charting to do. So when you go into the clinical facilities, you do have documentation assignments. So this goes from doing an assessment, so it depends. So this semester I'm doing a psych assessment. So I'm like, how's their behavior, how are they interacting, how's their speech, how's their mood, how's their affect, and all of this. So you have a list of things, and then you look in their drug orders. What are they taking? What are the side effects? What are my teaching points for these drugs? Are there any drug interactions that I should be aware of, and should I report something? And then this also helps you because you can actually know what you're looking for if you are interacting with the patient, and it may be a possible side effect for the actual drug. Then we also have, you could do also a care plan, and that goes from identifying the chief complaint for the patient, making some patient outcomes, listing your nursing interventions, evaluating the short-term goals, etc. So then there's also a reflective journal, where that's more of a kind of a diary entry. And obviously not every single semester will have this, but there'll be a list of questions, and that will just help you reflect back on the therapeutic communication you were having with the patient, what you can do better, what you feel you did not so well at, etc. So that's the paperwork. And when we got there, we didn't have our logins for the EMR, so like the system where it has all the patient information, all of the the entire chart is in the computer system. So me and my friend, we had no idea their past medical history. We don't know why they were admitted, and I was actually in a adolescent unit, and I had patients from 7 years old to 17 years old that had posed a threat to themselves or others, and so because we couldn't see what was in each person's chart, I tried to ask, like, okay, what's their deal, why are they here, just so I could understand. But the first 2 hours, I literally, me and my friend, we went and we separated, and we went and tried to interact with some of the youth there. So it was interesting because you're kind of not biased at that point because you don't know what's wrong with them. So you're for me, I was a little nervous because I don't know if you are violent. I don't know if you've been on your medication. You just don't know. So obviously the rules, keep 3-4 feet away from you. Make sure you know, your back is not towards anyone. You know, watch the patient's interactions, watch the responses. If someone's breathing heavily, they may be ready to, you know, act out in anger or violence. So all of that are things that are in the back of my head. And so my interaction was a lot more, for lack of a better word, chill. You know, I didn't just go ahead and talk. I'm like, okay, who are you? Why are you here? You know, I went and sat down and said, okay, what are you guys watching? And, you know, the TV was on and we watched TV for a little bit, and it's like, okay, well, what's your name? You know, my name is so-and-so, I'm here, student nurse, etc. And then it just made things a little more comfortable. I mean, I was, you know, I didn't want them to feel like I was just there to just learn about their issue and talk and force them to tell me stuff. So in that aspect, the clinical was a lot slower. And for the most part, you really are talking. So anyways, so I did that. You know, I started with the boys, and then I went and hung out with the younger, the 12 and below, and then I went to the teens, the girls section. And from just interacting, you then go and choose a patient where you will actually go further, interact, and do your paperwork on your assessments. So then I had a patient, but they were about to be discharged, but that wasn't confirmed. So my paperwork, really, I didn't want to start my paperwork because I felt like if the person gets discharged, then I won't have all the answers. So I kind of left it towards the end of the shift. Again, it's a 12-hour shift. It's super long. So then, you know, I played games, card games. You know, I talked. I sat with them during breakfast and lunch, and we just talked casually. And then, let's see, once later during the day after I got my login, I was able to go in and just see what, you know, why were some of the kids there. A lot of, and this is where it gets to the point where you're like, it's sad because you know their history, but then this is now the opportunity to be able to communicate with them and see what they tell me. You know, have them firsthand tell me what is going on in their life, and then it will allow me to be able to speak to them and see what I can do to help them cope. A lot of the youth that I saw were suicidal. Some of them, you know, were attempting suicide multiple times. Some of them are severely depressed. A lot of them were bipolar. A lot of them were acting out sexually. Some of them were frustrated. And just from that entire first day, I learned that these children, their home life is usually the big factor in their life and everything that's kind of going wrong. A lot of them were there, and they don't want to go home, and that's so sad. And some people were actually from juvie, and they were brought to the psych ward, and, you know, I asked, I was like, okay, well, you know, you know, was it your choice to be here, or did you want to be here? Is being here better than juvie? And obviously they're saying yes, I'd rather be here. And some people wanted to stay here longer. And the facility that I'm at, it's not a long-term stay. So for the most part, average stay is 7 to 10 days. And then a lot of them had worries about what's going to happen to them once the 7 to 10 days are up. Some of them didn't have a place where they could return to once they are discharged, and that's something that needs to be set up before they can leave. But going back to just hearing a lot of their stories, a lot of them are hurt, a lot of them feel abandoned, a lot of them feel like they don't have anyone to talk to or turn to when they're back in their regular home environment. And a lot of them, looking at the medical charts, do have parents that are have mental illnesses, or, you know, substance abusers, etc. So it's a difficult home life, and I could understand why it would be difficult for someone who already has, you know, an illness, to not feel like they have anyone to really turn to. So it's funny because when you're reading in the mental health book, you know, it starts talking about your support system and how important it is, and you know, make sure you find resources for them, etc. And I was able to experience firsthand that, you know, I asked this young lady, what would make your depression less and what would stop essentially making you want to kill yourself? And she's like, I just want to be heard. I want a better relationship with my mother. I do this because I feel like her life would be a lot better off without me. And it's hard to hear that. And so for me, because I'm a nursing student, we're there for only a short period of time, I and some of my other classmates felt like a little bad at the end of the day because we were able to go home. We're only there for 3 days, and we essentially didn't or couldn't do much. So I'm hoping that whatever I talked to her about, that she was able, you know, she'll able to recall, and it'll help her, you know, cope whenever she feels that down. But it's interesting because if someone has a physical or anything else wrong with them, instead of like a, I don't know, being schizophrenic, I feel like I can do something to help, etc. But you really can't do that with them. So then you kind of start feeling like, well, what can I do? How could I make this any better? So again, it is true, I think, during this clinical rotation, you will determine whether psych nursing is for you or psych nursing is not for you. Some people don't want to return to the facility. Some people can't wait to go back. I actually signed up to speak to criminals. They have a whole separate lockdown unit. And I would just like the opportunity. I would actually like the opportunity to work with adults. So I don't know if I'll get rotated into the other floors, but speaking to the youth, I felt very strongly about how some of the parents are supportive. Like there was this other patient where they were speaking to their family members, ran upstairs and decided to jump out of a 2-story building and actually broke an arm. So, you know, it's all because of voices, etc. So there are families that are supportive and understand that they can't provide the help that the patient needs. And there are other families that are just like, oh, just brush it off, stop being dramatic. But in reality, there is a chemical imbalance in the brain. They are hearing voices that are telling them to jump or to go kill themselves or kill someone else. And it's hard. I mean, I would feel horrible if I were trying to express myself and my parents did not want to listen to me, or they didn't feel like I had anything of value to say. It hurts. And then, let's see, I also really appreciated, and I was really astonished about the amount of honesty that the adolescents have. I think as adults with mental illnesses, obviously having gone through a bunch of stuff in their past, they are probably more reluctant to sharing that and being open. Most of the adolescents that I was with, I mean, I just had to introduce myself and make small talk and, you know, take the conversation easy, but they were able to open up. So I can tell that they need someone to talk to on a more regular basis. And I was in one of the, they have these like, you know, doctors, the residents, and then for us, it was us, 2 nursing students, and then you have the patient, and you kind of come in and you kind of do, I guess, maybe your daily evaluation, and you kind of talk about how they've been doing, how was their weekend, any side effects of the medication that they're on, provide the opportunity for them to ask any questions, and just kind of, you know, talk and just get an update. And this one person had a suicide precaution band, and they were like, I have a question. It's like, can I get off a precaution? And with precaution, at least at the facility, someone has to watch them at all times. So the person is literally behind this patient at all times, because, you know, they pose a threat to themselves. And the patient was, the doctor said, okay, well, are you having suicidal thoughts? And the patient goes, yes. And the physician goes and says, well, I think we should keep that on. And the patient goes, yeah, you're right. So, I mean, I would think that she would be like, no, I'm not having suicidal thoughts. And the doctor would be like, okay, well, let's consider it. Maybe tomorrow, you know. I just thought it was so refreshing to just see the patient just admit, yes, I'm having suicidal thoughts. Yes, I want to hurt myself. I don't want to attend a group therapy because I feel like I may hurt someone. Having the honesty is a lot better because, you know, the guessing game is kind of taken out of it. But overall, I had a really great time. The staff was very helpful. You know, a lot of the abbreviations, SI, suicidal ideations, I had no idea what that was, and I'm reading, I was like, okay, I think I should know this abbreviation, but I don't. They were open to talking. It was nice to be paired off with a peer. It was nice to just be able to communicate and interact with a lot of patients. I also like that it was a longer shift, because most of the time when it's like a 6-hour shift, from time of like your nursing duties, it's hard to get that and documentation in and then taking the most out of that experience. And that's one thing that I think you guys may also feel. I feel like the documentation takes away from the actual experience that you have face to face with someone there, but I know it's part of the job. So, you know, I always kept my eye on the clock just to make sure that I'm going to be able to finish my assignments, etc. And I really did like that I had the electronic medical chart, because I was able to look at everything that was relevant to the patient in my care. So it was good because, I mean, you see real life charts. It's not a sample in the book, and you're able to just learn and really go back. And some people have been there multiple times. Some of them say, oh, I'm going to leave and I'm going to come right back. So there's a lot to be done. I don't know if I'm at the point where I say I could see myself doing this. I could probably see myself doing this for the young adults, youth. I do want to work with children, so I think in that aspect I am interested in it. I don't know if, let's say, they put me in an adult unit, I don't know if I'll feel the same way, but we'll see if that actually happens. Let's see if there's anything else. We talked about pre-conference, documentation, we talked about client, therapeutic communication. I think that's it. Hopefully guys, you're doing well. Those that ordered the life planner, great job. I can't wait for you guys to get it. I ordered some of the new covers. It really is helping me stay organized still, and that's good. Let's see. I think I have 9 days left for this class, so it's just flying right by. I have 2 more clinical days. Yeah, so I can't wait. But if you have any questions, let me know. Leave it in the comments below, or check out my social networking sites. And I think that's about it. Don't forget to comment, like, and subscribe, and I'll talk to you guys later. Bye.